All right, now for the final and equally important part of the enteral feeding and gastrostomy process. This is where you sit down and chart. You've assessed your baby. You've made certain that all the equipment is cleaned and put away. You've made certain that your child is stable, happy, and doing whatever it is scheduled for the child to be doing at this point. Now you have the time to sit down with a pen and paper and document everything you've done. The charting will come into two different parts. The first one will be the insertion of the gastrostomy button. When you chart, make certain that you put the size of the gastrostomy button you used, the circumference, the fact that you did check for a matching size and circumference on the new button before it was put in place, that you check for patency of the balloon. You will chart the removal of the old tube and the insertion of the new tube, how much fluid you put inside the balloon. You will chart how your patient tolerated the procedure. You will chart the site care you did, the solution you used, what the site looked like, if it was intact, if there were any signs of infection or any signs of crustaceous material. You will chart that you checked the placement of the tubing and the method you used, either the insertion of air or the aspiration of stomach contents, or both if both procedures were used. And you would chart how your child tolerated the procedure. Since you proceeded almost immediately to the feeding after that point, you would then chart your feeding. You would chart the type of feeding you used, the amount, the time that the feeding was to run. You would chart the aspiration or reflux precautions that you took, i.e. elevating the head of the bed, observing the baby for signs and symptoms of either aspiration or reflux, whether the child exhibited any signs of aspiration or reflux, or whether the child was symptom-free, how the child tolerated the procedure, that the child was left in aspiration position for the required amount of time, which is 30 to 60 minutes post-feeding, and that your equipment was adequately